It is time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. We begin with new concern that your flu shot might not protect you this season as well as it should. The CDC issued an advisory this week to doctors warning that this year's vaccine may not be as effective as expected. So what happened?
Well, Vanita, every February or so, the World Health Organization gets together experts, and they try to guess what are going to be the predominant strains of flu the next fall. It takes all that time to make the vaccine. You have to grow it up in eggs. It takes a while. So this year, they made the guess, they started making the vaccine, and after that, the strain started to change. And the predominant strain, which was influenza type A, and specifically H3N2, about half of them, half of the cases that are out there are in fact covered by the current vaccine, but half of them had genetic drift. They kind of mutated away, so they're not as well covered. Now, to put it in perspective, in a typical year, the flu vaccine gives about 60% of people protection against the severe illness from the flu. And in the previous episodes, when this kind of discordance has happened, it goes down to 40%. So still effective, to somewhat.
If it's not as effective, the CDC is still recommending, Holly, that we get a flu shot.
Right.
But if it's not as effective, is it really worthwhile?
It absolutely is, because not only does the flu shot cover this primary strain, the H3N2 that John was just discussing, it also covers other strains like H1N1 and either one or two strains of influenza B. And this year's vaccine is a good match for those strains of the flu. Also, even if it doesn't match the major strain perfectly, you might still get some coverage from it. You may still get the flu, but you might not be as sick.
All right, for decades, a controversial rule has prevented gay men from donating blood. This week, an FDA panel met to discuss modifying the ban. The rule was imposed in 1983 to prevent HIV from infecting the nation's blood supply. Holly, what are the primary arguments on both sides here?
You know, Anthony, this is a really vigorous and kind of ongoing debate. Opponents of the ban say it stigmatizes gay people, and it brings us back to a time in the early 80s when HIV was spreading really rapidly and it was very poorly understood. People who suggest that we uphold the ban say we still have to acknowledge that HIV is more prevalent in certain communities. One of those communities is men who have sex with men. So even though testing of blood is much better, by increasing the amount of possible HIV in the blood supply, we're raising the risk of transmission.
But has there been any progress in terms of managing HIV and AIDS?
No doubt. I mean, Holly, you mentioned the early 1980s. I was an intern in 1981 when AIDS hit, and every single solitary one of my patients died. Every one. You go into medicine to cure people, to do good, and everybody died. And look where we are now. We have antiretroviral treatment, and it's been really unbelievable in terms of turning this into a chronic illness. And we do have progress in the availability of these drugs to people. So the availability has almost tripled in the last 5 years, so that's good. But no way do we declare victory here. There are 35 million people around the world, mostly in sub-Saharan Africa, who have HIV/AIDS, and there's still a long way to go.
A new government report says the number of births in this country declined for the 6th year in a row. The biggest drop was among younger women. Perhaps the most striking number in the report was that the teen birth rate plummeted by 10% in 1 year, marking an historic low. Researchers attribute this to fewer teens having sex and more using contraception.
Will an aspirin a day keep the doctor away? A new study says the benefits of giving some healthy women low-dose aspirin to stave off serious illness, like heart disease, may be outweighed by the risks. John, there's been an ongoing debate about giving baby aspirin essentially to healthy people. What did this study find?
Yeah, that's for sure. There's ongoing debate, and it's not going to end here. This study was a study of about 28,000 women, 45 years of age and older, and they were given 100 milligrams of aspirin every other day. And we tend to think of baby aspirin as 81 milligrams a day, so a little bit different dose. And they looked to see what's the effect on cardiovascular disease, heart attack, stroke, and cancer. So you've known that aspirin in people who have heart disease can be helpful because it can prevent heart attacks and strokes. And then in recent years, we found that the aspirin can also decrease the risk of certain cancers, especially cancers of the gastrointestinal tract. So the thinking is, well, maybe if it's not helpful for just preventing heart attack and stroke, maybe if you add in the cancer protection, it'll make a difference. So now that's what this study did. And they found that really under the age of 65, that the risks seem to outweigh the benefits of giving this aspirin in this study, and that really if there was a benefit, it was going to be in women 65 and over. And even there it wasn't certain, because you have this gastrointestinal bleeding, and you can have bleeding in the brain too. So this continues to be a tough one.
I find myself confused, as often happens at this table. So tell me, I mean, should we take it? I mean, the FDA is saying we shouldn't take it. Is there a final answer?
Right. You know what, Vanita, there is, and there is a final answer, which is the point that we sort of always end up at. There's no one size fits all. It has to be entirely individual. I absolutely believe the research that for specific people at high risk of heart disease and at high risk of getting cancer, aspirin can make a difference for them. Aspirin can be of benefit. I also know it can have serious and life-threatening side effects. Right. So it's really about taking each individual, looking at your risks, and deciding what's best for you, and that's done between you and your doctor.
Well, finally this morning, the company Empatica is seeking crowdfunding for a new smartwatch. Wearable technology is often fitness-focused and takes metrics on physical activity and sleep. But the new Embrace device is designed to gather medical quality data that can help predict unexpected seizures. So who is this meant for?
You know, I think it's interesting, not even speaking to this device in particular, but what it does opens up this entire array of possibilities. Yeah. You know, our skin gives a lot of information about what's going on inside our body. So in theory, we could use technology not just to pick up seizures, but to look for other illnesses, whether it's cancer, diabetes. I just think it really sort of gives us good ideas of where we can go with this.
And these gizmos, they're going to be attached to our body or even in our body to measure data, send it back. We're just at the beginning of this, and in fact, Google developed a contact lens that can measure the amount of sugar, glucose, in tears. Wow. And think how amazing that is for helping control people who have diabetes. You worry about their blood sugar going too low or too high, and I think we're just at the beginning of seeing what these things can do.
Amazing stuff.
Dr. John LePook, Dr. Holly Phillips. John, next time we'll tell you if we're all going to wear the same color.
Oh, sorry.
We'll make sure to include you.